Hello, everyone. Welcome to Chat with the Editor. My name is Maxwell, Assistant Editor of Social Media, AJNR, and I'm excited here to be joined by Dr. Reza Forghani from Advent Health, Orlando, Florida. It's nice meeting you, Dr. Forghani. Welcome to Chat with the Editor.
Thank you. Thank you for having me.
All right. So can you tell us about yourself and your educational background?
Yeah, so I'm a MD PhD trained neuroradiologist. In neuroradiology, I do both entire spectrum, including neuroradiology and head neck radiology. I also have had I'm also a medical AI expert. And during my career, I've had actually many engagements in research, some in AI, some not in AI, like in spectral CT. But in more recent years, a lot of my work has been in AI. And I've done everything from development now. I'm currently the imaging IT physician lead for the Department of Radiology at Advent Health. And we are very involved in acquisition and implementation of AI.
All right. Thank you very much. So why radiology?
By neuroradiology,
Yes.
I was always interested in brain. Actually, before I even decided to go in radiology, I had interest in neurosciences in general.
Okay.
Both surgical and non-surgical. And then when I ended up in radiology, that was a natural choice. The complexity of the nervous system, I think I would say the complexity and elegance of nervous system all simultaneously really appealed to me. The other thing that I grew, and sometimes this is confusing, radiologists are familiar with this, but non-radiologists sometimes get confused. Head and neck radiology is part of neuroradiology, at least within the imaging. Typically, that's what it's part of.
Yeah.
And as I got into neuro, I did really develop an appreciation with head and neck radiology. A lot of my research was on head and neck cancer, working closely with my ENT colleagues. And in head neck, it's really the complex anatomy. And what I find is that we are really at the center of patient management. So in head neck, the imaging is a core part of staging, which really determines how a patient is managed. And that I found very gratifying.
Right. Thank you very much. So what's your role as an editor in AJNR?
So I'm the senior editor for artificial intelligence. We are involved in various initiatives. Of course, we overview, me and our colleagues, I have two associate editors that work with me. We essentially screen and vet articles that are submitted. Frequently, we then send these out for peer review, and then depending on reviewer feedback, we then make a decision, either suggestions for authors to improve their manuscript or whether it should be accepted. We also are doing some side things. So right now we are sort of refining and making some guidelines to help authors. And that I'm hoping it will not be too long before those become available in terms of when they do artificial intelligence submissions, what could help their manuscript be successful in the submission process.
Okay, thank you very much. So as a senior editor, what do you think writers should put in their research papers?
It's a very important, not necessarily a simple question. AI has many facets, right? So there's everything from basic development. There are applications that are, things that are developed, but how they're applied in the clinical world. One thing that I've been trying to push, I think there's value for all of these. So of course, sometimes basic technical developments are very exciting. They grab headlines. But, we also know there's a big gap in terms of what's done in a lab and what can be used for clinicians. So I've also been sort of promoting and also trying to facilitate and encourage authors to submit quality articles on the latter. Because if you think a lot of readership, sometimes that's the information that's missing. Yes, this sounds good, but will this work in my practice? Will this fit in my workflow? Things that sometimes people don't think about. And in general, we obviously it's always helpful for an author, look at AJNR articles, write well. Those are just some basic guidance, right? But be scientifically sound. I realize that someone who's done research and reviewed many is that there is no perfect project. You can always find fault. And my general attitude is to try to get articles to a place that they get published. I want to facilitate. I would like AJNR to have, as ideally all neuro, that may not be possible, but as many neuroradiology applications, whether it's development or implementation, submitted. But try to be scientifically robust, and that means understanding the limitations. For example, if you do a prediction study that has relatively small numbers, make sure it's novel enough that it would be an addition to literature, but also make sure your methodology is sound. And sometimes that's not the latest methodology. So,
Okay.
for example, don't use methodology that is meant for thousands or 10,000s of cases on the study having 100. So I think if people use the right approach, that's sound, understanding the strengths and limitations, then there's an opening. Because like I said, we realize that studies are at different phases. Science is a step by process. We don't expect someone to solve everything. Just be sound, understand the limitations, of course, be clear, and make sure key things are there.
Okay. Thank you very much. That was a good one. All right. So, if a researcher has a problem concerning an article you reviewed, how do you think they should proceed?
So are you saying that if they want guidance or if they don't agree with the decision?
Both of them.
Okay. So in terms of guidance is tricky. Sometimes you can always you can write to us and we can provide some feedback. But you have to understand, unfortunately, because of the way the system is set up, we can only give limited feedback. And indeed, even when we encourage someone sometimes to submit something, we always have to tell them, look, when we send this out for your colleagues to review, if the reviews are really negative, we can't guarantee publication. So, but if they have question, for example, would this be a fit? I'm always happy they can write to me or the associate editors. They can write either of us. They can find us through the AJNR website, contact us and get an inquiry. I'm open to having inquiries that way. We are hoping the guidelines will help to show the scope and give some guidance. Now, if they don't agree, our process again, because we also have to be operational. So we have a great leadership. As you know, Dr. Max Wintermark is the editor-in-chief of AJNR.
Okay.
And in my view, he's done a lot of great things. And one of them, to make sure things are timely, that's important for any research, but especially in AI where things can become out of date. Now, to do that, we also have to have some, not strict, but clear guidelines, right? Because if we want to be timely, so the way we do is that when something comes to us, myself, the associate editors will look, sometimes we get other colleagues. We just want to make sure it's a good fit or that it has a reasonable chance of being accepted because we don't want to waste people's time. So sometimes there's that immediate reject. And look, that doesn't necessarily mean that the article is bad, but for whatever reason, is something that we think is probably not going to withstand the review process. And we would like to give the authors a chance to move forward. Now, a lot of times things get selected, looks good, then we send out for peer review. And then once we get peer review, it comes back and we decide. Now, and again, to be responsive and not have things in under consideration for months and months ongoing. After one review, we essentially look and I look at the feasibility. For example, of course, the reviewers have their own suggestion. I see how positive they were. If they want changes, how feasible it is. If there's a chance it gets, we send it to the authors. I can tell you philosophically, if I ask for a major review and you answer the key things, it's because we want to get it in. But for example, don't send something back that just doesn't address it or dismisses, right? But usually for me, I would not send something for major review if I don't want to give that article a chance. So if authors look at it that way, and part of that, by the way, is to make sure what the recommendations are feasible. Because if someone says, okay, do a whole new study, well, that's not a major review anymore. Now, if we do end up declining to publish, with AJNR and this general policy, it's a final policy. So it's just because it becomes very difficult to manage, and we understand sometimes for authors that's not, but then that doesn't mean it can go to other journals. Also, when we decline, especially if it's gone under peer review, we give them the comments. And one reason we provide that is that this hopefully can help them with their submission somewhere else.
All right. Thank you very much. Thank you so much. So, as a senior editor for the AI section, what do you think about AI replacing radiology?
Well, this is an interesting thing that comes up. First, I don't think anyone has a perfect answer, but let's take a step back and see where we are. There are, I think it was in 2015, some very smart people predicted that we should stop training radiologists because in 5 years we wouldn't need them. I can tell you it's a good thing no one listened, because right now there's a shortage of radiologists in the United States, in Canada. We can't get enough radiologists. So while technology can do anything, uh, I can tell you that sometimes I'm looking for an AI tool to be impactful. Indeed, we acquire, right? And one of the challenges sometimes is to make sure that what we're getting is useful. So I can say confidently that we're really a long way. I mean, I'm struggling. I want to make sure what I bring has return on investment. I mean, replacement is not even there now. I do think everyone, and by the way, this is not radiology. Indeed, I think radiology, we're very well positioned. We've been fortunate. Our major colleges, including American College of Radiology, has been proactive, and instead of trying to resist change, has embraced the technology so we can lead it. Every specialty will be affected, and if they by AI, and if they don't recognize it, they should. By the way, every non-medical field will be affected. So it will be disingenuous for me to say that there's not going to be a whole societal work shift. But the way I look at it is that technology generally has been radiologists' friends. And I always remind my colleagues, would they want to put films up, dictate or write manually? We do very well. We are so efficient is because we were one of the first specialties to go digital.
Yeah.
Technology has been our friend. So the way I look at AI is that we should embrace, we should lead it. And sometimes that means we should change the practice. And although there are certain things that they may not need us for, as is many cases, is that I think we're going to make new things that are even more impactful that we're going to be at the center of. So if I have anything to say, I said we are at risk. Everyone is theoretically at risk. I don't see that as an imminent thing, the opposite. And quite frankly, I think we could use this to increase our relevance to patient care. Because if you have value, ultimately, you're not going to be replaced. And that's the way to think of it. So if the technology does something, increase it, enhance it, or use the technology to do things we couldn't do that are impactful for patient, like helping them get the right treatments, helping avoid bad treatment. My opinion is with that attitude, we are likely to succeed. And indeed, this might be the golden age of radiology, because we went from looking at X-ray shadows, essentially, to cross-sectional, where we see things that you would have to cut a person to see. And I think this might take us to the next frontier in which we are actually predicting outcomes and having real impact on patients. And to me, that would be a golden age. So it doesn't have to be the thing that we replace. So, but embrace. But if you don't want to change, if you want to do everything the same, I would say whether you're a radiologist or non-radiologist or even non-physician, there's a risk, because there will be a societal change. This technology is transformative, is another type of industrial revolution, and we should adapt with it. But I tend to be on the optimistic side. I see a lot of opportunities for us right now as radiologists if we have the right mindset.
Thank you very much. Thank you so much. Let's talk about your career as a neuroradiologist. What's been the best thing about your career so far as a neuroradiologist?
As a neuro, I've been fortunate to be able to do lots of exciting things and get involved in new things. I've had an unusual trajectory. As a neuroradiologist, I got into neuroradiology research. Then I've been in head neck. I've been involved both in the national level and research scientific level in that. And then I got into AI many years ago, and I've been involved in all facets of it. So I would say that this has been a very rewarding career, because not only just neuroradiology by itself is so interesting in terms of the impact you have, and same for head neck radiology, but I've had the fortune that I've been able to, I guess, in some ways, expand my neuroradiology expertise to look at these other areas of medicine. And by the way, administration, I've had a lot of administrative roles where we can look not only at the tree, but also at the forest. Can we improve operations? Some of the things I'm involved now, or some of the things I was involved in some of my previous places. How do we use AI to improve operations for the organization to enhance care? So I think this has been a great venue really to do lots of exciting things that actually go beyond even a single specialty, sometimes even beyond just using radiology, just as physician, in terms of advancing science, do things. So it's been a great journey. So something I definitely would recommend for other trainees that are looking. I would say this is a great specialty to pick. There's something interesting for everyone in neuroradiology, whether you like detail, whether you like impact, whether you like innovation, there's something for you.
Thank you very much. Thank you very much. So what advice will you give to uh, radiologists or future radiologists, future neuroradiologists, people who would like to go into radiology?
Be adaptive. So I think it's a great specialty. Don't be complacent or fixed. I think my general advice to all radiologists is look in the broader picture. We were very insular at some point. Don't just sit in your reading room. Look at your impact on the patient trajectory. Think about other things outside of the department that impact care. You know, if we want to have effective healthcare challenges, people need to work together. We need to break the silos. So my thing is look beyond, look at patient outcomes, engage in administration, try to improve processes. And when it comes to technology, be nimble, adopt it, but understand the limitations, because as much as I'm an enthusiast for AI, the one danger, and I think it's by the way for public because these tools are available, is everything we see online is not correct. Everything a generative AI gives is not correct. And sometimes even it's not that there's a intention to harm, but there's a potential. And as radiologists and other physicians, to successfully implement these tools, we need to understand both the strength and the limitation. And they have limitations. And actually, as we become reliant on them, we have to make sure we don't get automation bias, meaning that we are so reliant that we forget our role is to provide oversight. And when the machine is not doing it right, we are there. We are the ultimate call. I think in some ways people should be excited about that. That's our value, one of our values in the chain, right? That's your protection, but also to be a safe radiologist. Because sometimes I do wonder, these technologies are so robust, you get complacent. Oh yeah, it said something is not there, so it's not there. No, there's a reason these devices are cleared as triage, because we have to provide oversight. So that's good for the specialty, but also it's an important thing to mind. I know at Advent Health, we have actually now a targeted AI training program. Some of that is to familiarize, but part of that is to make trainees aware of the strengths and pitfalls. So they utilize it to be better physicians and more efficient, but they also know how to safely use it and make sure they continue to be vigilant and provide proper oversight over these models.
Thank you so much. Thank you so much. And to the last question, so what do you like to do outside of radiology?
What I like to do, one is that travel. We are big travel fans, and we have children. Of course, the travel has changed, but we like all sorts of travels and seeing new places. That ties into history. I do enjoy history, and sometimes if we go somewhere new, there's a historical aspect. We might even read up on the place before we go, especially in the places with lots of historic background. And part of that is also we are foodies, so all of that also ties into the travel. Now, beyond the travel, foodie, and the history, certain sports, especially I tend to like tennis, and a lot of I play, and my children play. So that's another thing we enjoy, and some other things that we are taking up. But I would say those are the key things.
Thank you. Thank you so much, Dr. Forghani.
Thank you very much. Thanks again. And look, I encourage everyone, considering you have a good AI project, we want to see it, please submit. We would like AJNR to be the home for your good scientific research.
Sure.